We know that heart continues its function in a rhythmic or cyclic manner. This cycle is basically called as cardiac cycle. Let's look at its proper definition. The cardiac events that occur from the beginning of one heartbeat to the beginning of the next are called the cardiac cycle. Cardiac cycle starts under the influence of conduction system, explained previously. Before going in details of cardiac cycle, there are two terms to understand: diastole and systole, where diastole refers to the period of relaxation in which heart chambers gets filled with blood, while systole refers to the period of contraction in which heart chambers pumps blood and get emptied. In clinical practice, the term systole refers to ventricular systole and diastole refers to ventricular diastole. Now let's try to understand the cardiac cycle in detail. We know that cardiac cycle is a series of cardiac events. These events can be divided into two categories. First one is atrial events, in which atria of the hearts are involved. And the second one is ventricular events, in which ventricles of the heart are involved. Here, atrial events are further divided into atrial systole, that lasts about 0.11 seconds, and atrial diastole, that lasts about 0.69 seconds. Whereas the ventricular events are further divided into ventricular systole, that lasts about 0.27 seconds, and ventricular diastole, its duration is about 0.53 seconds. Ventricular systole is divided into two subdivisions that are the symmetric contraction and ejection period, and ventricular diastole is divided into 5 subdivisions that are proto-diastole, asymmetric relaxation, rapid filling, slow filling, and last rapid filling. Here we are going to start with the description of atrial events, where first one is atrial diastole. As name implies, it is the period of atrial relaxation, or it is the period of atrial filling. During this phase, simultaneously, ventricular systole or contraction also starts. Atrial diastole lasts for about 0.69 seconds. This long atrial diastole is necessary because this is the period during which atrial filling takes place. Here, right atrium receives deoxygenated blood from all over the body through superior and inferior vena cava. Left atrium receives oxygenated blood from lungs through pulmonary veins. Next one is atrial systole. As name suggests, it is a period of atrial contraction. Atrial systole is also known as presystole. It is usually considered as the last phase of ventricular diastole, and its duration is 0.11 second. During atrial systole, the intra-atrial pressure increases due to contraction, but only a small amount, that is 10% of blood, is forced from atria into ventricles. These atrial events usually takes place simultaneously with ventricular events that are of much significance in cardiac cycle. Let's look at description of ventricular events, where first comes ventricular systole. That is the period of ventricular contraction, and it is further comprised of period of isometric contraction and ejection period. Isometric contraction period. In cardiac cycle, it is the first phase of ventricular systole. It lasts for 0.05 second. Asymmetric contraction of ventricular muscle is also called isovolumetric contraction. It is named so because this phase is characterized by increase in tension without any change in length of muscle fibers and no change in blood volume. This phase starts immediately after atrial systole, when the atrioventricular valves are closed due to increase in ventricular pressure. Semilunar valves are already closed. Now, ventricles contract as closed cavities in such a way that there is no change in the volume of ventricular chambers or in the length of muscle fibers. only the tension increases in ventricular musculature. Because of increased tension in ventricular musculature during isometric contraction, the pressure increases sharply inside the ventricles. So what is the significance of isometric contraction? Well, during isometric contraction period, the ventricular pressure increases greatly. When this pressure increases above the pressure in the aorta and pulmonary artery, the semilunar valves open. Thus, the pressure rise in ventricle caused by isometric contraction is responsible for the opening of semilunar valves, leading to next phase, that is, ejection of blood from the ventricles. Next one is ejection period. So, due to the opening of semilunar valves and isotonic contraction of ventricles, blood is ejected out of both the ventricles, from right ventricle to pulmonary artery, and from left ventricle to aorta. Hence, this period is called ejection period. Duration of this period is 0.22 seconds. Ejection period is of 2 stages. First stage is rapid ejection period. It starts immediately after the opening of semilunar valves. During this stage, a large amount of blood is rapidly ejected from both the ventricles. It lasts for 0.13 seconds. Second stage is slow ejection period. During this stage, the blood is ejected slowly with much less force. Duration of this period is 0.09 seconds. Here, we should understand 2 terms related to ventricular systole. First term is end systolic volume. Ventricles are not completely emptied at the end of ejection period, and some amount of blood remains in each ventricle. Amount of blood remaining in ventricles at the end of ejection period is called end systolic volume. It is 60 to 80 milliliters per ventricle. Another term is ejection fraction. Ejection fraction refers to the fraction of end diastolic volume that is ejected out by each ventricle per beat. Normal ejection fraction is 60% to 65%. Clinically, it is considered as an important index for assessing the ventricular contractility. Ejection fraction decreases in myocardial infarction and cardiomyopathy. The second important ventricular event is ventricular diastole. That is generally a period of relaxation of ventricles. It is subdivided into 5 divisions. Starting with protodiastole. Protodiastole is the first stage of ventricular diastole, hence the name protodiastole. Duration of this period is 0.04 seconds. Due to the ejection of blood, the pressure in aorta and pulmonary artery increases, and pressure in ventricles drops. When intraventricular pressure becomes less than the pressure in aorta and pulmonary artery, the semilunar valves close. Atrioventricular valves are already closed. No other change occurs in the heart during this period. Thus, protodiastole indicates only the end of systole and beginning of diastole. Then comes period of isometric relaxation. Duration of isometric relaxation period is 0.08 seconds. Asymmetric relaxation of ventricular muscle is also called isovolumetric relaxation. It is named so because it is the type of muscular relaxation characterized by decrease in tension without any change in the length of muscle fibers, and no change in blood volume. During this period, once again, all the valves of the heart are closed. Now, both the ventricles relax as closed cavities without any change in volume or length of the muscle fiber. Intraventricular pressure decreases during this period. So now what's the significance of asymmetric relaxation? Well, during isometric relaxation period, the ventricular pressure decreases greatly. When the ventricular pressure becomes less than the pressure in the atria, the atrioventricular valves open. Thus, the fall in pressure in the ventricles caused by isometric relaxation is responsible for the opening of atrioventricular valves, resulting in next phase that is rapid filling of ventricles. Next phase is rapid filling phase. When atrioventricular valves are opened, there is a sudden rush of blood that was previously accumulated in atria during atrial diastole from atria into ventricles. So this period is called the first rapid filling period. Ventricles also relax isotonically. About 70% of filling takes place during this phase, which lasts for 0.11 second. After rapid filling of ventricles comes the slow filling phase. After the sudden rush of blood, the ventricular filling becomes slow. Now it is called the slow filling. It is also called diastasis. About 20% of filling occurs in this phase. Duration of slow filling phase is 0.19 second. Now the last phase of ventricular diastole is last rapid filling. Last rapid filling phase occurs because of atrial systole that starts simultaneously with ventricular diastole. After slow filling period, the atria contract and push a small amount of blood into ventricles. About 10% of ventricular filling takes place during this period. Flow of additional amount of blood into ventricle due to atrial systole is called atrial kick. So this phase is actually same as atrial systole that we explained earlier. Here is an important term, that is end diastolic volume. The amount of blood remaining in each ventricle at the end of diastole is called the end diastolic volume. It is about 130 to 150 milliliters per ventricle. So this was all about the description of all cardiac events. Let's summarize the complete cardiac cycle together with its all events. So now we know that cardiac cycle is a series of cyclic events that takes place in one heartbeat. It starts with the phase of atrial diastole, where the atria relax, AV valves are closed and blood enters into right atrium from superior and inferior vena cava and into left atrium from pulmonary artery. Then starts the phase of ventricular diastole. It starts with the period of isometric relaxation. Where ventricles are relaxed, AV valves get closed and semilunar valves are already closed. So now ventricles are just closed cavities with no change in blood volume. Then occurs the period of ventricular filling. That is rapid and then slow. When pressure inside ventricles exceeds to pressure inside atria. AV valves gets opened. Semilunar valves are already closed. Blood accumulated in atria rapidly enters the ventricles. Then after rapid filling, the remaining blood moves slowly from atria to ventricles in slow filling phase. Atrial systole, in which atria contracts, AV valves are still opened and small amount of blood enters the ventricles. This phase is submerged in ventricular diastole and is also considered as the last period of ventricular diastole. After this ventricular filling, now ventricles have to contract in a phase called ventricular systole. Here, first comes the period of isometric contraction, in which without any change in volume, all valves gets closed, and as a close cavity pressure starts to rise inside the ventricles. When this pressure exceeds, then starts the phase of rapid ejection. In this phase, pressure in ventricles increases than the pressure in atria and ventricles. So this pressure opens the semilunar valves, while the atrioventricular valves gets closed. Here ventricles contract and the blood is ejected rapidly to the pulmonary trunk from right ventricle and simultaneously to aortic trunk by pulmonary vein. So once this blood is supplied, the deoxygenated blood from body and oxygenated blood from lungs again enters the heart via same route as described earlier, again entering the phase of atrial diastole, and so the whole cycle continues. The healthy heart beats around 60 to 100 times per minute. Any interruption in this cycle can lead to serious heart-related problems. So this was all about cardiac cycle. Now, another important topic linked with cardiac cycle is the sounds produced by heart during cardiac cycle. So basically, the sounds produced by mechanical activities of the heart during each cardiac cycle are called heart sounds. Heart sounds are produced by flow of blood through cardiac chambers, contraction of cardiac muscle, closure of valves of the heart. And these heart sounds are heard by placing the ear over the chest or by using a stethoscope or microphone. These sounds are also recorded graphically. 4 heart sounds are produced during each cardiac cycle that are called first heart sound, second heart sound, third heart sound, and fourth heart sound. Here, first and second heart sounds are called classical heart sounds and are heard by using the stethoscope, whereas the third heart sound is a mild sound and it is not heard by using stethoscope in normal conditions. And fourth heart sound is an inaudible sound. It becomes audible in pathological conditions only. Have a look at its details. First heart sound is produced during isometric contraction period and earlier part of ejection period. It is a long, soft, and low-pitched sound. It resembles the spoken word lub. The duration of this sound is 0.10 to 0.17 second. Major cause for first heart sound is the sudden and synchronous or simultaneous closure of atrioventricular valves. After first sound, the second heart sound is produced at the end of protodiastolic period. Second heart sound is a short, sharp, and high-pitched sound. It resembles the spoken word dub or dup. Duration of second heart sound is 0.10 to 0.14 second. Second heart sound is produced due to the sudden and synchronous closure of the semilunar valves. Third heart sound is a low-pitched sound that is produced during rapid filling period of the cardiac cycle. It is also called ventricular gallop or protodiastolic gallop, as it is produced during earlier part of diastole. Usually, the third heart sound is low pitches and inaudible by stethoscope, and it can be heard only by using microphone. Duration of this sound is 0.07 to 0.10 second. Third heart sound is produced by the rushing of blood into ventricles and vibrations set up in the ventricular wall during rapid filling phase. Normally, the fourth heart sound is an inaudible sound. It becomes audible only in pathological conditions like ventricular hypertrophy, long, standing hypertension, and aortic stenosis. It is studied only by graphical recording, that is by phonocardiography. It is also called atrial gallop or presystolic gallop. Duration of this sound is 0.02 to 0.04 second. Fourth heart sound is produced during atrial systole by contraction of atrial musculature and vibrations set up in atrial musculature. Study of heart sounds has important diagnostic value in clinical practice because alteration in the heart sounds indicates cardiac diseases involving valves of the heart. So, this was in-depth video about the physiology of heart and cardiac cycle. It must have improved your knowledge. For more such videos, keep watching sqadia.com.